2023 Medicare Changes. What are they and how do they affect me? Why should I care? Hi, this is Kathy Bukowski. I'm the owner of CB Health Insurance and the CB Health Insurance YouTube channel. Welcome to today's video. If you're new to our channel, don't forget to subscribe, hit the little bell so that you get future notifications when we release videos, which is about twice a month. Don't forget to tell your family and friends and give us a thumbs up if you like the video. Now, on to today's topic. What are the changes for 2023 to Medicare and why should I care? I'm going to tell you. Well, let's talk about Medicare. Medicare A, B, C, and D. There's different parts to Medicare, but let's start with Original Medicare. Original Medicare is Part A and Part B. It's your hospital and your outpatient. We get that through the Social Security office. 99% of the people pay zero premium for Medicare Part A. Why is that? Because it is 100% subsidized by the taxes we've been paying all of our working life. As long as we've paid into the system at least 40 quarters, or our spouse has paid in for 40 quarters, we get free or zero premium Part A coverage. Now, the other people that don't, either didn't pay into the system, they could possibly be coming from another country, they have the option to buy into the system, all right? Part B premiums are based on your income, but the vast majority of people pay the standard premium. For 2022, that premium was $170.10. The good news is for 2023, it's going down. It's going to be, for 2023, it's going to be $164.90. So that's savings $5.20 a month for most people on average. And, you know, with inflation and everything, the cost of goods going up, every dollar counts. There's a lot of reasons for this, but the main one was because Medicare estimated what they would cost for a very expensive drug that they were taking a look at covering. So the way they corrected this, because they had a big increase in the premium for 2022, and it was the biggest increase in Part B premiums in the history of Medicare, they made an adjustment for 2023. So that's good news. For the deductibles, now I'm going to stay with Part A and Part B before we get to C and D and talking about premiums. I do want to talk about some of the changes in terms of the deductibles. Part A is your hospitalization, and Medicare will pay after a deductible. Currently for 2022, that deductible is $1,556. So it's over $1,500. It's going up to $1,600 in 2023. And oh, by the way, that's per hospitalization. Now, not to fear, because if you're on Original Medicare Part A and B and you purchase a supplement, most supplements will pay that Part B deductible, whatever it is. So Medicare or CMS is going to make changes every year, raise that deductible. If you have a supplement that pays that Part A deductible, it's going to pay it, whether it's $1,500, $1,600, $1,700, or whatever. So that's the good news. The bad news is they're going to pay it, so therefore they're probably going to pass a rate increase on to you every year. Medicare supplements are based on a couple of things, what they're paying out, but also your age. And every year you turn a year older, plus they're paying more if you are hospitalized. So for those reasons, you will see an annual increase in your Medicare supplement premiums, okay? Now, if you're hospitalized beyond 60 days, Medicare will pay after a copayment per day. Typically the supplements that pay the Part A deductible, they're also going to pay those copayments, and those go up over time too. Most people are not in that situation, but you know, it's whatever the deductible is, the supplement's going to pay it. Now, if you don't have a supplement, you are responsible for that Part B deductible, and you probably want to talk to an agent about getting a supplement. Now let's talk about Part B and the outpatient services. There is an annual deductible. This isn't per service, but it's an annual deductible, and it's currently at $233 for the year 2022. For 2023, it's going down. So the premiums are going down and the Part B deductible is going down. It's going to be $226 one time. So once you hit that, whether it's going to the doctor or having a test done, anything done on an outpatient basis, except your prescription drug cards, is going to be your annual deductible. After that, Medicare is going to pay 80%, And that's not changed. That is the way it is currently. And then if you have a supplement, typically the supplement pays 20%. Again, if you don't have a supplement, you're responsible for paying the 20% coinsurance, right, after the deductible. And oh, by the way, that coinsurance, that 20% is uncapped. There is no annual maximum. So if you have tens of thousands of dollars of claims, if you're going for outpatient chemotherapy, and you don't have a supplement and have Medicare, original Medicare only, Medicare is going to pay 80% after the deductible, and then you would be responsible for 20%, and that's unlimited. So talk to an agent about a supplement. Now on to parts C and D. Part C and D, C is a Medicare Advantage, right? And D is a standalone drug coverage. Most people know that. You can't have both. You have one or the other, and you get your drug coverage either through a Medicare Advantage plan, which is offered by private insurance companies, or you get it with a standalone drug card, which is also offered by private insurance companies. Both of them have to be approved by Medicare. They're a Medicare subsidized program. So every year you can shop. Now the premiums are going to vary. On a Medicare Part C Advantage plan, they can be anywhere from $0 up to over $150. And what's happening is there's more and more and more Medicare Advantage plans. All you have to do is open a newspaper, look online, or watch commercials, and you see not only the advertisements, but the articles, because CMS is getting a lot of complaints. People are confused. They don't know what to do. In fact, Medicare is even doing advertisements now saying you can go to Medicare.gov and shop for a Medicare Advantage plan, and even a toll-free number for assistance. So Medicare Advantage premiums are going to be set by the insurance companies, but they're anywhere from $0 to $150. So there's actually more and more zero premium PPO plans out there. Now those plans are not free because they do come with copays whenever you have any services done. You're going to pay a copay if you have a test done. You're going to pay a copay if you see a specialist. Okay, so it's not free. It's just a zero premium. Part D hasn't changed drastically. Part D is the standalone drug coverage, and premiums run between $8 and maybe $105 a month. But it behooves you to shop every year. If your drugs have changed greatly, if you have a lot of new prescriptions. Now, if your drug card, the premium went up $1, there's a couple of drug cards where the premium went down for next year. You're on the same maintenance meds, you're able to fill them at your preferred pharmacy, and there's no changes, then there's absolutely no reason to shop. But if you have a lot of changes, you may want to shop, and you can do that at Medicare.gov. If you are in the state of Illinois, you can shop through our website, and we'll put the link here for those companies that we represent. And I have to disclose that we do not represent every company that sells Part D and Part C plans in the state of Illinois. Going on to what else are changes with Medicare, and specifically this came out of the Inflation Reduction Act that was recently passed this year, and there are two additional benefits that Medicare recipients will have in 2023. The first is lower cost insulin. So for those individuals that are taking insulin because they're diabetic, those can be very expensive, and starting in 2023, it's going to be a $35 copayment per 1 month supply per dose. So if you have multiple, I don't know if people have multiple insulin medications, but $35 is a really good deal. The second benefit, and that clearly doesn't affect everybody, it's only those people that are diabetic taking insulin. The second benefit is that you're going to have free, all Medicare recipients will have free ACIP recommended vaccines. What the heck is that? ACIP, I had to look it up, is the Advisory Committee of Immunization Practices. And there's some sort of governing body that says, this is recommended for seniors. We need to pay for this. The government needs to pay for this. So there's two new vaccines. Shingles is one. They're not new vaccines, but they're being covered now under Medicare. Shingles is one, and the second is whooping cough. So starting in 2023, talk to your doctor. You can get these extra benefits. If you're on Medicare, and it doesn't matter if you have original Medicare with a supplement and drug card, or if you're on a Medicare Advantage, they all have to cover these plans. So you don't need to shop for that. So what are the changes in summary of the benefits for Medicare for 2023? Well, the premiums are going down. Some deductibles are going up, and we have some new benefits that everybody can take advantage of. We hope you enjoyed this video. Don't forget to tell your family and friends, like our post, give us a thumbs up, and until next time, this is Kathy Bukowski, the owner of CB Health Insurance.